St James's Hospital, inner city, Dublin. One of the country's biggest and busiest hospitals.
You did really well.
Big breath in, please.
Over 400,000 patients are treated here every year for a huge range of illnesses.
I was diagnosed with HIV. I thought I was going to die of AIDS.
Here, life and death are daily realities.
Oh, God.
Pressure is pretty low.
You bring your A game.
Security at the ambulance bay doors, please.
From the front line to the back office, hard decisions have to be made.
The hospital's full. There just physically isn't anywhere to put these patients.
And the pressure is always, always on.
It's a national emergency.
I'll just leave you here now, and then I have to go in to see the doctor, and you can come in with me. Okay?
Noel Masterson has Alzheimer's. He's cared for at home by his wife, Phyllis. Today, they have an appointment with Dr. David Robinson in the outpatients clinic. Phyllis wants Noel admitted for further examination and testing.
I think there's something wrong with him. Apart from Alzheimer's, I think there's some little thing there that I just can't put my hand on, and I want them to investigate him.
Have a seat. I'll just get this chart. Hello. Hi, Noel. How are you? Good. Noel's getting a bit frustrated at times, isn't that correct?
Well, since Saturday night coming into Sunday morning, he got this aggressive. He wanted to go use the toilet all the time,
Right,
bowel
okay.
motion, and he couldn't go. No, he pushed me about twice. But he'd never done that before.
Okay.
He's
Okay.
aggressive.
So his behaviour has changed?
Yeah, completely changed. I just love him to be checked out. He was never checked out.
Well, I'll
in
check him out.
hospital.
I'll check him out.
You know, he was never checked out.
Yeah, yeah. I'll check him out.
I know he's only a patient to yours, but he's my husband.
Oh, I understand, but that's why
Yeah.
hospitals are very dangerous places for someone in your husband's situation.
Yeah.
And we know that if an older person is put in bed on bed rest for 3 days, they lose 10% of their muscle mass in that time.
He's losing it anyhow.
I know.
You know, he's losing it anyway
Yeah.
rapidly. He's getting thinner by the day.
There's a social worker here today, and we'll see about getting some emergency respite for you. That we might get him in, maybe not into hospital, but we have Hollybrook and Inchicore, that we might be able to get him in there. And we can see him in the day hospital in another couple of days.
Would you not just take him in here even for 2 days to clear that up?
Well, let's see if we can get him into the respite.
I don't want him to go into red. I want him to be in here to get that checked out. They won't do that in respite. I need to get something done.
Where's your cough? Is it gone? Have a bit of banter with the patients, don't be like
That's what it's all about. It's all about the patients.
and
They're happy, we're happy.
yeah, they enjoy our company and we enjoy theirs.
And in between we get a bit of cleaning done.
Morning. How are you? Did you get some sleep?
Yeah, well, I was waking up at 2:30, 3:30, 4:30.
Oh, I know, Andrea.
30-year-old Andrea Devine has breast cancer. Today, she will have a double mastectomy and a full breast reconstruction. It's a long and tough operation. Surgeon Liz Connolly comes to brief her.
Like I said before, the main thing to concentrate is, today is about taking away the cancer.
Yeah.
'Cause sometimes you kind of get wrapped up in the whole reconstruction bit, which is really important.
Yeah.
But, the main focus today is that we get rid of this for you and then also reduce the risk of future cancers. But we've been through it all anyway.
Yeah. It's not...
Yeah. Are you sure you've nothing else
I'm
to
ready
think
for
about?
it.
Yeah, you weren't waking up thinking about anything particular last night?
No. I just...
Been in the hospital?
Yeah.
I'll see you later. I'll see you down in the anaesthetic room anyway.
Yeah,
Just
perfect.
all right, okay, mind yourself.
Like, I did cry and I was thinking, the what ifs. The first person I was thinking about was my daughter. Because she was only 1.5 years, so I wanted to see her growing up.
Hiya. Are you all right to walk out of the trolley, or do you want me to bring it into?
No, I can walk in.
Yeah?
I'm just going to check that. And you have the stockings on.
Yeah. Lovely.
Andrea came to see us in June of last year, and she presented with a right breast lump that had been there for over a year, and she was quite relaxed about it because she'd recently had a child, so she felt it was related to the pregnancy, and she had no family history of any breast cancer in the family. But she had all her imaging and her biopsy done, and that confirmed then that she had breast cancer.
Yeah, so the first case is Andrea Devine. She's a 30-year-old lady that presented in June 2017 with a lump in her right breast. It was about 3 centimetres of diagnosis, very close to the nipple.
You can see the mammogram here. When we look at the ultrasound, at that point we can see a typical invasive tumour immediately behind the nipple. So you can see the tumour here.
When Andrea was first diagnosed, she discovered she carried the rare gene mutation, BRCA2.
In the BRCA2 population can be as high as 50% risk of getting another cancer.
Because of that risk, Andrea has opted to remove both her breasts, giving her the best chance of beating the aggressive disease now and into the future.
To have to make a decision, you know, take both my breasts away, nearly like half your womanhood is gone, but it has to be done to stay alive. It's either that or have the risk.
Okay, you're feeling very tall today, are you?
Oh, huge. Not as tall as you now, giant.
It's one of the bizarre things in the world is somebody drawing all over you first thing in the morning.
After Andrea's breasts are removed, plastic surgeon David O'Donovan will perform the reconstruction, hoping to move living tissue and skin from her back to help create new breasts.
Okay, and we're back to me. I'm just going to pinch you a little bit, okay?
Yeah.
This is where we're going to take the skin to reconstruct the area where Andrea's nipple is removed. And we're going to mark out the area where that muscle that's underneath the skin is going to keep that area of skin alive. And we're going to use this area of skin here to replace the area of skin that Professor Connolly removes at the front. All right, we're good to go.
Yeah?
Yeah.
Hope you had plenty of sleep last night.
Plenty of sleep last night. All good. You all here for?
Good evening.
Branko, did the cattle come in?
Oh, over 1 million meals per year.
Are you free? Rick? Would you like someone from Project?
Emergency Department consultant Dr. Una Kennedy begins her shift. It's one of the busiest days of the year, and the department is severely overcrowded. Una's main job is to try and clear the backlog of patients and reduce the waiting time for people to be seen.
No chest pain or anything, just generally feels unwell, generally feels loud.
It's busy. We came on this morning to a 13-hour wait to be seen. The waiting room was full of patients who had slept on chairs overnight. There were 22 inpatients waiting on trolleys for bed this morning. So the hospital is full. There just physically isn't anywhere to put these patients.
We've been here since midnight last night, and it was about 10 hours in total waiting in the waiting room. The place was packed to capacity, I would say. There's a lot of noise, a lot of commotion. Turns out I have appendicitis, so I was right to come in.
It just slows the whole place down. It's really hard to keep the place moving and keep processing patients when it's that busy. Obviously, this isn't something that's going to clear up in the next couple of hours.
Just squeeze my hand. Okay, so there we are. There's the tumour.
Help, my dad, he's just left. Help, please. What's going on? Is he dead?
No, he's just not responding, so call for help. Go get something, call 999 and get something.
Brilliant, that's all we want.
Breast cancer patient Andrea Devine is facing a grueling 12-hour double mastectomy and reconstruction. Surgeon Liz Connolly will perform the mastectomy. However, this radical surgery is not a guarantee that Andrea will be cancer-free at the end of the operation.
We really won't know until we remove the tissue and the pathologists go through it in detail to see whether there's any residual cancer But clinically, you can't feel a lump anymore. That doesn't mean there's no cancer there, and that's why she needs to have the tissue removed. And then Andrea's case, she also needs to have it removed because of her high risk of the future, because of her gene carrier status. So we're removing the nipple and then the whole breast. And then what we're preserving is a skin envelope in the fat and the blood vessels. So this is where we start now to disconnect the breast from the chest. You see we remove the breast in one segment, which is the nipple in the centre, and then leaving all the envelope. You can see the whole shape of the breast, with the nipple in the centre, and then that little corner is the tail of the breast. Okay. And you can see everything looks the same. This is where a tumour was, but you can't see anything.
Andrea's breast tissue is taken to the pathology lab, where senior medical scientist Lisa Ryan begins the examination. This will give a first indication as to whether Andrea's cancer has spread.
We usually feel through the different slices to see if we can identify any tumour, which is usually any firm area.
It's 2 p.m. The overcrowding in the emergency department has worsened. Patients are being assessed and then wait to be treated according to priority. The average wait for treatment now stands at 14 hours. ED consultant Dr. Una Kennedy is working hard to clear the backlog. She's been asked to attend a bed management crisis meeting as the knock-on effects are felt across the hospital.
I think my time is better served here, seeing the patients in the emergency department. But on days like today, when it's particularly busy, I'll go down to that meeting to try and get a picture of you as to where we're going to be going late into the evening.
Good to see you.
We got on top of it this morning, but there's now 33. But we just had the buses arrived. There's 33 patients waiting to be seen.
Are there?
Yeah. Right. And we're chock-a-block. I'm in there 2 to a cubicle, and now the corridor is into, and zone 3 is just full. There's 82 patients in the ED.
Yeah.
How are things then there, Anna?
Yeah, exceptionally busy. There are around 90 in the department at the minute. There
90?
Yeah.
Yeah.
There's 21 accepted, 18 have no beds.
Okay. Thank you. Jenny, how are things?
Yeah, very, very slow. My big concern today, typical Tuesday, is my cancers. But there's one bladder tumour there that I am worried about, and we've had to cancel the other 2. So I just went back to teams, got them to prioritise, but it looks like we may be cancelling cancers again today.
Today is a bad day. That is not a good day. We don't like to have meetings in the middle of the day. Obviously they'll have to cancel some patients. Who's the most appropriate to cancel? It's really unfortunate, and you don't want to do that. And the last thing you want to do is cancel anybody who's coming in for cancer surgery.
Get your hand on me face.
Hit yourself.
Phyllis Masterson is struggling to look after husband Noel, who has Alzheimer's. The HSE have offered a home care package of half an hour a day, which Phyllis feels isn't enough. Today, they are attending the outpatient clinic run by Dr. David Robinson.
If you sit up here. Great.
He's just deteriorating by the day.
Yeah.
Yeah. I think there could be something sinister going on.
Yeah,
I think.
Now, let's straighten your legs out first.
Straighten the legs.
Can you straighten them out? No, I got you. I'm here.
It's not my fault. You're okay. You're okay.
He is still bunged up in there quite a bit.
Yeah.
So what we'll do is we'll check some bloods on him. I can admit him to hospital, but if he comes into hospital, I don't think he'll go home again.
Well,
it won't be up to you.
No, I want him to be admitted. It's really, I'm at the end of my tether now with him with this.
All right, okay.
I really am. Don't know how stressful this is.
I do. I've been with you over the last few months over this.
It's so stressful.
I know.
I've no toilet downstairs.
Phyllis, will you have a chat with the social worker for me, and let's see what we can figure out.
I went into her before. She was to get me some help. I got no help. The HSE rang me yesterday and said they can't send me help yet because they haven't got it. I mean, it's just ridiculous.
I'm trying to avoid getting him into hospital if possible. I'm not saying I won't do it, Phyllis, but
No,
we need to explore all the other options.
Honestly want you to do it because I've no toilet downstairs.
He may have to come through the emergency department. That's what I'm trying to avoid.
Yeah, well, if he has to, he has to.
Yeah.
No, I don't think he's going to do it. No, I'm not arguing with him now, you know. I don't believe him if he goes into hospital that he won't come out. He will come out because I'll take him out. Respite is not going to do anything for him.
We've seen this situation, Bill, for months. I'm very disappointed that the home care package hasn't gone in. It's very hard to not appear helpful to somebody when they're not getting any help. Do you know what I mean? So if it's the thing that we need to step in and rescue, then of course we'll do that.
I think it's just I'm neglecting myself. You're not able to do it. No, you're not staying here. I know you're not staying here. I'm staying with you. I'm with you. If I could sell you, I would. Do you think I'd get any money for you if I sold you? Not much.
Phyllis, I understand that you're very stressed by the situation, and I agree that it can't continue. But I worry that it's part of a bigger picture, which is that I don't know how you're going to manage at home.
I won't be. I will manage if this stops.
If there's emergency respite in a day or two, would you go for that option?
I'd rather have him checked out first here. Well, I'd rather him be comfortable because he definitely isn't comfortable.
I know, yeah. I know I'm really digging my heels in, but it's just, I've seen this so many times. If he comes in through the emergency department, he may spend some time there, longer than he needs to be. He'd be on a trolley. It's about what's best for him. And my worry is if he's admitted, things will get worse and he won't get home again.
Hey, that's sweet. Thank you very much.
Not at all.
You're such a sweetheart.
Yeah, I'm allergic to cats.
Okay, you're not allergic to any medication?
Just cats.
Once we get her sorted, so you have the wedge for sitting around?
I have the wedge here.
Okay, all right. So we go face over this side first.
Breast cancer patient Andrea Devine has been in theatre for 6 hours now. The mastectomy is complete and her breasts have been fully removed. Plastic surgeon David O'Donovan will now seek to reconstruct Andrea's breasts using implants as well as tissue and skin from her back.
A mastectomy is a horrible operation. It's quite mutilating, really. So to provide reconstruction the same day, even if it's not exactly what you had beforehand, to be able to leave the hospital, wearing a bra without having to have an external prosthesis is huge. Yeah, you let it go. So we're just going to raise the skin first, and then we need to raise the muscle off the chest wall. The muscle that we're taking is it's actually a very large muscle in the back. This is what we need to do the reconstruction. This is the skin that's going to replace where the nipple has been removed. Very important that the muscle and the skin remain attached to each other at all times. Otherwise, the blood vessels that are going through the muscle won't keep the skin alive. But the idea is we get underneath the muscle and free the muscle from the chest wall, which we're doing now. Take that away. Okay. So there's the muscle and the skin that we need. And the blood vessel that keeps it all alive is coming out from underneath her shoulder blade up here. And the muscle is still attached to her arm.
The skin and muscle from Andrea's back is guided through a tunnel to the front of her body. This is a telling part of the operation. The shape and form of Andrea's new breasts depends on cutting and moving the right amount of tissue.
Flaps. We have to make sure that we manage to move the muscle and the skin flap. So we push it up into the armpit, and we're going to bring it down out through the front. And hopefully we have all the bits that we had at the back and the front. So the markings that we made at 8 o'clock this morning, this is when they actually become important. So we have to know where the actual, the outside line of her breast base was. If you try to change the size dramatically, well, if you try to make it bigger, you're not going to have enough skin, and if you try to make it very small, you're going to have a lot of extra skin. So yeah, we can get that in more. So Okay, we're going to take the 3O monocle. Only the first breast finished. Strangely, the tissue that you move from the back, sometimes when they scratch it afterwards, they feel it in their back. It still thinks it's back there, because the brain still registers it as being in her back.
Andrea, it's all over, Pep, it's all done. You're just waking up now, okay? The operation's finished.
Security to Alan's bay doors, please.
Because you kind of think that someday you're going to be here yourself, you know, and you'd like someone to look after you the way you look after them.
Dr. Cliona Nicalig and nurse Anne-Marie Lawley run a specialist inclusion health service for homeless patients.
So Anne-Marie and I are working on improving how the hospital looks after homeless patients. It's really sad because you see people who've had a lot of trauma in childhood, and the sad thing is that having had trauma in childhood means you're much more likely to have other traumatic experiences as an adult for a number of reasons. So it's kind of a snowball effect. So homeless men in Dublin, their life expectancy is 42 years, and homeless women is 38. 38. It's very, very short. Cheryl, sorry. Do you mind if we wake you up?
Cheryl Downey has HIV and has been admitted with a serious chest infection. She's asked Cliona and Anne-Marie to help her change hostel accommodation so that she might better manage her HIV and addiction issues.
That's the one thing that we can't, I haven't been able to do is get anybody moved. Yeah. Sorry, Cheryl, that's the truth.
Yeah, no, that's it.
It wasn't a good choice for you at any point, you know, unfortunately. I know you didn't, you know. Yeah,
I will die.
You will die.
You will die.
Yeah.
I feel myself like gone.
You're too sick.
Yeah.
What you need is like a month in bed with TLC.
I need a stew injection. Yeah.
A stew injection?
Yeah.
I love it.
We'll see if we can put in a drip.
It was just respite for now.
Just respite and trying to see if we can get you to, in the medium term, to somewhere. I think we've got plenty of evidence.
Yeah, we will do our best with that, but again, see that, can't promise that now either. It's highly likely in the case of Cheryl that she won't get a change of hostel by the time she will be discharged. There's nothing worse than, you know, it comes to the day of discharge, like, but sure, I can't go back there, you know, and then it's as if you've done nothing. So you have to be able to say it from the start, you know, we'll do our best, but I can't promise you. It's outside of our control, no more than it's outside their control, which of course is the most frustrating thing about it for them.
Housing is it's really the foundation stone that you build everything else on, and leaving people in situations that aren't livable in, which I would say is what lots of people have to live in, it really severely affects their health. And that's what we keep trying to illustrate, is that if you want to reduce trolley times and improve waiting list times, that one of the ways that you can do that is making sure that people are properly housed and supported so that they don't get sick and they don't need to come into hospital.
Today, Cliona is trying to track down Tommy Kiernan, a HIV patient who has failed to attend the clinic for over 3 months now. Without his medication, Tommy's HIV will become life-threatening.
Anybody who's not taking their antiretrovirals, their immune system is kind of being chewed up by the HIV. Hi? Tommy Kiernan? No? Or TKD, he's sometimes known as. He's a rapper. You don't know where he transferred to by any chance, do you? So when I was little, I wanted to be a detective because I was obsessed by Sherlock Holmes. Being a doctor in general, you're kind of trying to figure things out all the time. It's a little bit like being a detective. It's voicemail. I might just try one more. Every week that goes by is a week that his HIV is going to be getting worse, that he's at risk of getting AIDS, getting cancer. He's also at the highest risk of passing the HIV on to somebody else, as well as them getting sick themselves. Follow the leads. They're out there somewhere. It's just a question of finding them.
Phyllis Masterson was hoping to have her husband Noel, who has Alzheimer's, admitted to hospital today for further tests and examination.
So I just had another chat with Phyllis there, and I was able to suggest that maybe they come to the day hospital tomorrow, and then from there we could look at admitting from the day hospital if necessary, and she was happy with that. So she feels she'll cope for another evening, and then we can assess tomorrow.
Yeah, it was a long battle, you know, but I think I won. well, 1:30 in the end. They don't really agree with me. But I don't want to put him into a nursing home because I don't think he'll ever come out if he went in.
I do believe in ghosts. We do occasionally have the odd person walking in our peripheral vision. They'd walk by and you'd turn your head and there'd be nobody there. We would have had saws being turned on or taps turned on. When I die, will all these people with their lovely stitch marks that I've given them, are they all going to be waiting there and they're going to get me back?
Emergency department consultant Dr. Una Kennedy and the bed management team are still struggling to clear the huge backlog in the ED. Throughout the day, staff have dealt with a record number of patients.
There's still 6 unplaced on the outpatients list. Okay. And oncology day are still lining in.
Pretty crappy.
Yeah.
It's like a motorway, you know, as soon as anything happens to slow down traffic, it takes a long time to decongest a traffic jam.
We've had about 4 or 5 in their 90s, and we're still only placing.
Yeah, and you've got a few significant long waiters there as well, so you need to try and get them sorted. Okay. I wish we had more beds today.
That's my brother-in-law. He was my sister's husband, and she died.
And that's my sister-in-law. The babysitter.
Busier today.
Busy day, yeah.
Very busy today. It really is. There's no
busy most of
beds.
the time, but this is the worst I ever seen him.
You okay, Dad?
Yeah, I'm good,
He had a fall in the kitchen.
I had a fall in the kitchen. And
So,
I hurt my knee and back of my knee.
we've no complaints with the staff. I know they're very busy and I know it's a very long waiting list. I think if you come in with that mindset, they're doing their best and you just have to be here. They're going to look after you, so.
17 and a half hours since I first arrived in, and I'm still sitting on a chair. No bed yet.
As Una's busy emergency department shift ends, she briefs the remaining ED team on the situation.
And Emer, everyone who's been on this morning has worked so hard to get the place back into shape, and then the tsunami arrived and we've been playing catch up ever since. We came on to a 13-hour wait to be seen. We've had significant issues with inpatient overcrowding during the day. So we have 87 patients in the department now. 28 are waiting to be seen. So,
In a new record, Zone 4 have already streamed 65 through.
so thank you everyone for all your hard work. So I remain on call on my phone until 8 a.m. So the phone will be with me overnight. I'm available to come in. I'll be in within 20 minutes for a particularly sick patient, major trauma. I sleep at home in my bed as I normally do, go to bed. I don't have any problems going to sleep. If I've been on the floor here for 12, 13, 14 hours, I normally go home and pass out in bed pretty quickly. So sleeping isn't a problem. Waking up in the next morning is the problem.
We can hold 4 bodies in each fridge.
So this is me one step closer to divorce.
What? Oh.
The old staying late for an educational case.
Go home, like, you know.
It's the day after Andrea Devine's major mastectomy and breast reconstruction surgery.
How are you?
Plastic surgeon David O'Donovan checks on her.
Are you sore?
I am a little bit sore, but it's more so just on my back.
Have you had a look down yet?
I did, I like them.
You like them?
Yeah.
Great.
I was quite happy.
Okay, excellent. Have a little peek at the front if you don't mind.
Yeah.
That all looks good.
Yeah,
Nice and soft.
I'm happy with them now, I have to say.
Okay, so far
Well
so
done.
good. Thanks very much. So everything went great, and so far so good. All right.
Thanks very much. It's brilliant. Really good. Like I'm delighted with how they look now, and I can't wait to see when they fully healed up, and like which will take a couple of weeks to see what way they look then. But right now, I'm delighted with them. Isn't she so cute? I'd like to just squeeze her.
I never got treated so good in all my life. I won't want to go home, I'm telling you.
7 weeks ago, HIV patient Cheryl Downey was released from hospital after recovering from a chest infection. Today, she is attending Dr. Cliona outpatient clinic for homeless patients.
I think we're going to need to bring you into hospital.
I don't feel well. But
And I can see even over the time I've known you, you've lost weight.
I've lost 3.5 stone. I'm 7.5 stone. I should be 11
No
stone.
way.
I'm just so drained. I have no energy. I keep getting dizzy. I am really sick.
Oh, you are really sick?
People are telling me, like...
I mean, you have what we would call AIDS.
I do have AIDS,
you know?
I do. And that's what's going to kill me.
That is what's going to kill you
Drugs
unless we
aren't
can
going
get
to kill
things
me.
sorted out for
Drink
you.
is not going to kill me. AIDS is going to kill me.
But the combination of them.
And like, I need to get better for my kids, I really do. A 15-year-old,
If we could get a year under your belt of stuff being
6
sorted.
months, man.
6 months. Oh, you wouldn't know.
Get me on the
yourself.
fire and I'm not touching the gear.
So I'm going to go down to A&E and write up her drug chart so that she can get her methadone and her other things so that she's not feeling sick and tempted to leave. And I'm not going to make you run down the corridor. So far. Sorry, change of plan. Maybe a bed Margaret Keogh direct. I'm going to write you up for your fine now and get it for you. Is that okay? So if we just turn around and go back. Jesus.
Dr. Nikialik has decided to admit Cheryl so that her feet can be treated. She also wants to ensure that Cheryl receives her methadone. While today the hospital is less busy, finding a bed is still a challenge.
Has Sean gone to get your pyjamas? I'm so sorry. The system is just like, it's crazy. The system as it works isn't ideal then, and you're at risk of them wandering off and coming back much later when their infection is up to their knee and they need their whole leg amputated, and you end up with loads more problems. So it's just the system not being able to cope with you identifying, okay, now is a good time to go in there and go in there early, and the system can't always cope with that very well.
Oh, is he? Yeah, I'm just wondering if we have a bed at all for
Cheryl Downey.
Cheryl Downey. I'll just ask the girls, yeah. I'll ask the girls to pack it up. Yeah, that's brilliant. Thank you so much. No worries. Bye. Bye.
The good news is I was talking to a doctor who works in the Thompson Centre, and they're going to take you on. So that should be sorted when you get when you leave from here. You should be.
I can just go there and then go straight to respite.
Yeah.
That'd be brilliant.
Oh, you
I have to hug you.
Oh.
I love you so much. Oh, that's a good one for the camera. That wasn't just for the camera, by the way. That was genuine.
Wasn't. I get
that was a
hugs all the
genuine.
time.
That was definitely genuine.
With one problem solved, Dr. Nikialik moves on to the next. She's still trying to track down patient Tommy Kiernan, who she fears is off his medication.
And Tommy is also on the missing list still no answer from his phone. Okay, no answer, I'll give them a call again. You just don't give up. Because what's the point in giving up? It doesn't achieve anything.
Yeah, you have to enjoy a bit of a sleep now, eh?
How far can you walk normally?
What do you mean, how far can I walk?
Can you walk easily?
Oh, yeah.
A mile?
Well, I never tried it.
A week after her major surgery, cancer patient Andrea Devine is leaving hospital.
Oh, I'm heading home. Yeah, heading home. Delighted, can't wait. I am looking forward to seeing Holly. I'm looking forward to seeing Jay. I'm looking forward to getting back to normal. Recovering. That's it, really.
Even though Andrea's tumour has been removed, she still faces an anxious wait to know whether the cancer has spread beyond the breast tissue. Final results from pathology will take up to 2 weeks. It's another busy day at the hospital. There are no available beds, and the bed managers have some hard calls to make.
So, now, Eileen, let's go through your list. You have a lot of counsellors booked in today.
I have, yeah.
Can we get one of his in as a dosa? We've people waiting at home, waiting on phone calls. Is there a bed? Is there no bed? We know we can't cover all these patients, so we need to start counselling now and putting people out of their misery. Hello, it's Jenny here from the hospital. I'm ringing you with bad news, I'm afraid. I don't have any discharges today to bring you in. I am so sorry. There's no definite beds in St James's Hospital.
Good morning. It's Eileen and James's. How are you? And there are days that you go home from here and you feel absolutely awful about the day you put in, buddy, because you put yourself in their situation or your family in their situation as well. They're all people at the end of the day waiting to come in for something to be done with them because they're sick. And that's unfortunately the way it is.
Yeah, this is your 6th time. OK, well, what we'll do is we'll make a note beside your name that you've been cancelled 6 times. We'll go back to your surgeon, we'll ask her for a new date, and as soon as we have a new date for you, we'll put you in the diary. No, please don't give up. Don't give up hope. Don't give up just yet, OK? I mean, we have to be going into better times in the summer. We have to. Yeah, there's already a note beside your name that you've been cancelled 5 times, but it's just today it didn't make any difference. A&E is busy and I've nobody going home from the orthopaedic ward. I'll do my best. I'll do our best, OK? OK. Thanks for being so nice about it. Good luck. See you then.
Yeah, you ready for him? Perfect.
Anyway, very nice bloke. Cancelled for the 6th time today.
I'm just going to have a listen to your chest, okay?
Right, okay.
And I'm going to work this side. I'm just going to put a little line in your arm.
Okay.
Is that all right?
Yeah. It's like a Formula 1 pit stop, so.
Yeah.
You're changing the weeds.
Okay.
It's 5 weeks since Phyllis Masterson brought her husband Noel to the outpatient clinic at St James's. Noel has Alzheimer's. A week ago, his condition deteriorated and he was admitted to hospital.
He was very bad on Sunday, and I put him to bed. He got out of the bed, he slipped out of the bed. He hit his back off the radiator. He stood up and he fell right back down on his face again, so I knew there was definitely something wrong. No, you can't clear that away because that's because you had the needle there and it's just marked, it's just bruised. So you'll probably never come home again. No. Ideally, I would like him just to live out his life till he was about 90, 100. And fight with him every second day. And then just finish our lives like that, not to be in a hospital. So now I don't know what's going to happen.
Right, we'll see you in a little bit.
I'll see you in a minute. I'm not going away. I won't be a minute. I'll be back. I'll be back. Well, I have to keep telling him he's coming home tomorrow. And I'll say that again tomorrow. And I'll say it the next day. I just keep saying, you're coming home. Every single day I say to him, you're coming home tomorrow. Just to relax him.
I have been up in the wards and a few of the patients did say that the steak and the roast beef was gorgeous. You know, I haven't tried it myself, thank God.
Dr. Cliona has been trying to locate homeless patient Tommy Kiernan for 3 months now. She suspects that Tommy is off his HIV medication, which greatly threatens his health.
So we've tracked Tommy down. He's staying in a hostel, which actually turns out is really, really near the hospital. It's not much further than from one end of the hospital to the other end. And we phoned ahead and they said that he's there. So I got his medication and the stuff I need to take, his bloods. And sometimes it can seem a bit like, oh, that's not our job. But then in many ways, it can actually save a lot of trouble later down the line. say for Tommy, if we can see him now and get him back on his tablets, then his immune system won't get to the point where he gets really sick and needs to come into hospital for a long period of time or needs to go to intensive care.
Good to see you. You too.
This is exciting. I get to come to you instead of you.
Yeah, I know.
Come on, we'll go in, I guess. Unless we're doing an outside clinic.
Like I got did you see my album?
No, do you have it? I want to see it. I want to hear it.
Hang on. I haven't got a CD player, but I'll show it to you. That's me out in
Oh, look at you.
East Wall. There's me out in East Wall, yeah.
You look great in that picture, Tommy. We need to get a bit of weight on you.
And then there's me prison ID on the back. I did a song about Mountjoy Prison on the album. Yeah, so that's the album.
Okay.
Karma's a Bitch.
Karma's a Bitch. I'm going to go out and buy a copy of it.
Karma's a Bitch.
From my local
you
record shop.
You don't have to buy a copy of it. There's a copy there.
Are you sure?
Yeah.
Do you have spares?
What?
You have some? I'd love
got
that.
A good few,
Brilliant.
yeah.
Thanks a million.
That's a $5 on me.
Fair enough.
This is fucking huge.
Jesus, look at the amount of weight you've lost, Tommy.
I know.
We need to get
don't
you.
remind me.
Fed up.
Okay.
Just there. Oh, okay.
See?
Yeah. Well, hopefully that'll come down when you're on the triple therapy.
Lost a hell of a lot of weight.
Sure have.
Yeah. What about the HIV?
That might take till next week.
Right. I need to get clever. I need to endeavour. I need to do whatever it takes to get better and get my head together and never go back to crack, smack or snow blow. That's a no-no. You blow all of your dough. Fuck up and head for the hills. Jack and Jill, Jill and Jack, both took crack and smack and never came back. I had a crippling effect. Some make it, some take their last breath. But there's hope. You have to keep on trying. Like Dufresne said in Shawshank Redemption, get busy living or get busy dying.
Okay, Tommy, I will see you. Call in to me in about a month in clinic.
Yeah.
If I don't see you, I'll come looking for you. Deal?
Yeah, deal.
Hopefully you'll be you'll be a stone heavier, you'll look 10 years younger and you'll have loads of energy.
Yeah.
And you'll have your new rap verse.
Yeah.
You look like I wouldn't have recognised you.
Yeah,
You just
But you know
look
what?
worked out.
You know
Do you know
what?
you're almost at the AIDS stage now, Tommy? We need to get you out of that and back healthy.
See, the AIDS
Yeah.
stage? Oh, don't say that.
Well, these guys.
Don't say
If
that.
you keep taking these guys, you'll be back in the full of your health.
But what you call it? Yeah, you're saying you didn't recognise me.
Yeah.
The next time you see me, you won't recognise me because I'll have so much weight.
Brilliant.
Yeah.
Awesome.
Yeah.
I look forward to it.
Yeah.
You forgot Valentine's. I saved your life.
It's 2 weeks since Andrea Devine had major double mastectomy and breast reconstruction surgery. Today, she is back in St James's to meet with surgeon Liz Connolly and to hear if her cancer has spread any further.
Hi Andrea, sorry about the wait.
Hi.
I'm really sorry.
Fine.
It's a crazy clinic.
It's fine.
So how are you?
Good.
Yeah? So we looked at everything this morning and there's no evidence of any residual cancer. So all the cancer that was there was killed by the treatment.
Right.
So we call it a complete response to the therapy.
Oh,
so
that's
it's
so good, isn't it?
fantastic. Yeah, we're all delighted for you.
Oh my
so
God,
a really
it's
good
brilliant.
outcome. And that, but it's important for the future as well, How do you feel about that? You're all right?
I don't know, I think I'm a bit in shock or something.